Hello, and welcome to another edition of Focus. I'm your host, Vernon L. Bolling, ACA, Affordable Care Act. Let me share this with you. Marketplace/Obamacare Open Enrollment 3. This is the third open enrollment for the health care. 2 have passed, this is number 3. The Open Enrollment Act started November 1st and extends to January 31st. That's very important for you to remember. So we want you to remember that. So basically, we're going to talk about health care today. We're going to talk about the Obamacare today, and I have 2 guests who are very knowledgeable in that arena. Sit back, relax. Maybe you might want to get a piece of paper, a pen, something to write with. All of this and more when Focus continues.
We want to share that with our kids, that love for being outdoors, and that's what we're doing. Seeing them run around and pick up a stick and be like, look at this, Daddy. They get their little lanterns and they walk around with those and looking at bugs and hearing noises and wondering what everything is. I mean, that's kind of what it's all about. Frankly, I didn't really know that the lottery supports natural preservation. So it's a big plus of playing.
Welcome back to Focus. Today we're going to talk about health care, the Affordable Care Act, or we might say ACA. So either one, you'll know what we're talking about. Today, to help me discuss this topic, or I should say they're going to be discussing it, I'm just going to be asking questions, is Mr. Ernie Tai with the Centers for Medicare and Medicaid Services, and Mr. Alan Jervik with the Arizona Alliance for Community Health Centers. Welcome, gentlemen.
Thank you.
Did I pronounce everything correctly?
It's great.
Okay, I just wanted to make sure. One of the things is I really dislike mispronouncing someone's name. So, but sometimes my tongue gets a little tied there. Ernie, I'm going to start with you. And some of these I'm going to just take off my page here, so it's a lot easier. Arizona did not choose to implement its own marketplace. Has this has affect enrolling for the people of Arizona? So the marketplace, I guess it wasn't done. Has it affected the enrollment?
So Arizona is a federally facilitated marketplace state, one of 37 states that chose that FFM status. That means that the federal government is helping out with enrolling Arizonans into the marketplace coverage. We're coming into the 3rd year of open enrollment. We've started the 3rd year of open enrollment. Arizona has had very successful enrollments into the marketplace, as well as the Affordable Care Act's other main feature, which is expanded Medicaid. And Arizona also expanded its Medicaid program and has gotten a lot of enrollees both in the marketplace and in Medicaid.
Ernie, I know there's been 2 open enrollments before. This is number 3.
Yes.
Do you expect the numbers to really increase on this one? I mean, I know it's not that important, but I'm just wondering and that'll let me know a lot of how successful it has been in the last 2.
So in the first 2 years, we got actually quite a few enrollments across the country. I think there's been a lot of discussion about whether or not, now that we're more maturing into year 3, we're going to get that same level of enrollment increase. We're encouraging everybody to go to healthcare.gov, our website, and take a look at what might be available to them. And through programs like yours, we're trying to educate the public about just how affordable insurance coverage can be.
Okay, website again?
Healthcare.gov.
Okay, we want to make sure we put it up on the screen.
And we also have a telephone number, 1-800-318-2596.
Okay.
It's open 24 hours, and we have call center representatives there who can speak to you in person and guide you through the process.
Excellent. Alan, let me ask you, what role does the Alliance play in implementing the marketplace enrollment in Arizona?
Every state has to have at least 2 navigator organizations, and they receive grants from CMS. The Arizona Alliance for Community Health Centers has been the largest recipient of navigator grants in Arizona since the program began. So we're entering the 3rd year, and we have a commitment of funding through year 6. So we have assisters all over the state, trained people that can help Arizonans enroll in both Access and the Marketplace. We have approximately 100 navigators and about 250 other certified counselors across the state at more than 21 community health centers and about 16 community agencies that really work with specific populations.
Here's a silly question, either one of you. Why is it just for a year? Why can't it be done for 3 years? It's a question. I mean, is it something that you can't answer?
I can answer that. Actually, under the Affordable Care Act, the Marketplace has an obligation to each year make sure that you are eligible for the Marketplace coverage.
Yeah, you're answering the question. Yeah, right. So you want that eligibility in a 3-year period. Things could change.
Yeah.
Yes.
Exactly.
Okay. I didn't mean that to be a quick trick question. I'm just in my mind, I see it as such a great program.
Of course.
Why do you have to go through this, one-trick pony every year? But that answers it right away.
Yeah.
Though we will renew you automatically into a comparable plan, say for 2016, if you don't make an active choice.
Okay, so basically, if I did it last year and I was qualified, and are you saying that if I don't reapply, you'll pick me in a plan this year, or if I apply and don't reach that plan, get accepted, you'll put me in a plan? Which one?
It's a little bit of both.
A little bit of both. So leave it to me.
If you want to continue your coverage into January 1st of 2016, and you've been in coverage in 2015, then we would ask that you go to our website or call our call center by December 15th, choose another plan, or choose the same plan you're in, and you'll have continuous coverage into January 1st. If by December 15th you happen not to have gone to our website and made a choice for January 1st, then the Marketplace will just automatically renew you into the same plan or the next most comparable plan.
Okay, I understand. Let me ask you this one. In 2013, Governor Brewer signed a law expanding the state's Medicaid program access to include single adults with no children, no dependents, I should say. How do you see this affecting the health status of our communities of color?
It's incredibly important. I'm so glad you asked the question. So far, because of both expanded Medicaid and the Marketplace, about 500,000 people in Arizona have gotten coverage.
Okay.
The larger percentage is the expanded access. And these childless adults, as well as families with children, can now get access up to a higher income level. So there are thousands of people in Arizona that have not yet tried to get coverage, whether it be Marketplace or Access, that are actually eligible for access. Speaking of communities of color, this has been very important because Latinos and African Americans in Arizona have very high rates of no insurance.
Really?
We've made great progress in the first 2 years.
Good.
And when I mentioned community organizations, we work with organizations. They were selected because they had a track record in helping people with access. So we knew they could learn how to help people through the Marketplace. And they were selected because they work with specific demographics, whether it be African American, Latino, Asian Pacific, Native Americans. So our program statewide is really trying to reach all Arizonans. But one thing you could always do is help get the message out, because if you don't even try to get coverage, you're not going to get coverage. And you may be eligible for a very low-cost plan through the Marketplace, or you may be eligible for access that is, for a practical purpose, no charge to you.
To me, or to our program and our audience, this is a very important topic. So you guys must stay very busy.
Busy, and we work together because there's the national website and
Attached
the
by the
national
hip,
phone number.
huh?
Well, we've been traveling together for for 2 weeks. Yeah. Actually, we've been training people all over the state to be the best they can be at assisting people. And assisters work for nonprofit organizations. They are not paid by the insurance company. They are simply there to help people navigate the system. And that system could be access, it could be food stamps, or it could be the marketplace.
You mentioned, is it a sister?
Assister. Yeah, there are different classifications of, these people are kind of like case managers, social workers,
Okay.
and there are different classifications, but the big umbrella is assisters. And Vernon, there's another umbrella I need to tell you about.
Okay, go ahead.
Cover Arizona is a coalition. St. Luke's Health Initiative helped organize it. We have more than 900 organizations and people involved all over the state to collaborate, reduce duplication, reach hard-to-reach populations. In fact, we've got a seminar coming up on hard-to-reach populations. Arizona is unusual compared to some other states because all these nonprofit organizations, whether they be healthcare, human services, food banks, we're collaborating because we want people to get the coverage they deserve and they're qualified for.
Interesting.
Vernon, maybe I can add. So there's sort of 3 levels that folks can learn about and get coverage. For those who really are digitally inclined, there's the healthcare.gov website, all sorts of information on that website, and you can apply and get coverage here in Arizona, and marketplace coverage, through using that site. Or you can call our call center or Cover Arizona's call center and get coverage telephonically. But with Alan's group and all of his affiliate groups, they're really in-person counselors where you can set up a face-to-face meeting with a real person who will walk you through it. So there's sort of 3 avenues. People like different ways of interacting to get coverage. Alan's groups are very important because of the in-person, and I call them counselors. Might be a way for people who just like to talk to someone about what's available.
Well, and here in Arizona, there's still a large percentage of people that do not communicate digitally. They're not comfortable for one reason or another.
Right.
So the in-person assisters, sometimes it's cultural because certain cultures want to do business face-to-face. We have many languages throughout our assister community. One group offers 23 different Asian Pacific languages.
Wow.
All of our partners have Spanish and English, and we even have some that speak Somali, other African languages, as well as French. We don't run into too many French-speaking Arizonans, but we will help anybody, no matter what their language is, because through the call center that Ernie has mentioned, we can tap into 50-plus languages.
That's unbelievable. You know, this is the 3rd year. I remember talking about it last year. I don't remember if I talked about the health. I must have, but the first year. But I can just hear the changes, the improvements that you've added. Speaking of improvements, 2016 is close.
It's on us.
It's on us, right? It's on us.
It is here.
It's here, right? You might as well say it's here.
Yes.
Now, Ernie, what improvements in the marketplace has occurred?
Vernon, I'm really glad you asked. So we had a little bit of a rocky start with healthcare.gov in 2014. Ironed all of that out. 2015 went pretty smoothly. For the 2016 open enrollment period that we're now in, now that it's November 1st, we're making additional improvements. We have new tools for applicants that will allow the applicants to filter their results by the doctors that they see, the hospitals they might go to, the drugs, the prescription medications that they take, and we have a way of filtering if you happen to be, say, a high utilizer of medical care services or a low utilizer or someone in between. With these 3 tools, you can filter your results so that you can find the plans that cover your doctors, hospitals, and drugs, and they're ranked lowest to highest priced based on the total amount of money you might spend on medical care based on your usage of medical care.
Before we say goodbye, is there anything that I possibly missed that you feel that's important that the people need to know about?
There's one point I'd like to make, and that is that 8 out of 10 Arizonans who went to the marketplace and signed up received financial assistance. There's a lot of rumors out there. This stuff isn't affordable. But you can't believe the rumor, because the person that you're speaking to may be of a different age, a different income level, and have a different number of children. Those things drive the rates that you will pay, as well as the level of coverage you need. So we like to just say, try it, look at it. It costs nothing to go to healthcare.gov or to meet with an assister. Find out your options, because there are more options today than we've ever had before. And we want to reach those hard-to-reach populations, whether it be ethnic or geographic in Arizona or any kind of demographic.
Before I say goodbye, I know you have a website. I know you have a telephone number.
Sure.
Do you by chance know that?
I can mention the local one. Ernie, do you want to mention the other one more time, the national one?
So our national marketplace call center telephone number is 1-800-318-2596. Again, it's open 24 hours a day, and we have customer service representatives waiting to help you, assist you in buying coverage, or in finding out what your options are.
Okay.
CoverAZ.org. CoverAZ.org is the local one where you can get information, but you can also make an appointment to see one of these face-to-face counselors or in-person assisters. Or you can call 844-790-4946 and speak to one of these trained assisters. They can answer your questions, and some people need to renew. They've been through this a couple times, right?
Okay.
Call the assister if you have a question, and maybe you can just do it on your own.
Gentlemen, thank you for joining Focus and sharing with us
Thank you.
this important information. We're going to be right back with more Focus and more about the healthcare in Schuyler Hall right after these messages.
When I look into my children's eyes, I'm always thinking of what it is that can make my kids feel safe. If nothing else, I think that's what we can help our kids grow up with, that innocence. The fact is, my kids are going to be exposed to a lot more stuff that I ever was at an earlier age. It's concerning. Learning about the good that the Arizona Lottery is doing, it definitely changed perspective. I become a millionaire, great, but I know that there's something good that's happening out of it.
Welcome back to Focus. We're talking about Obamacare, open enrollment. Don't forget our open enrollment started November 1st, but it goes until January 31st. That's important dates that you have to remember. Okay, my next guest is Mr. Schuyler Hall, who's the Regional Deputy Director of Enrollment America. He's here to discuss strategies and ways to make enrollment into Obamacare not so difficult.
Most definitely.
Was it difficult?
Try not to. We try to save people time, energy, and money. So anything that helps them out, we'll take care of them.
Schuyler, can you tell me a little bit about your role in Enrollment America?
Indeed. So Enroll America is a nonprofit, nonpartisan organization that's focused on getting folks quality, affordable care that works best for them. So my role as Deputy Regional Director is to work with consumers directly, help them understand their health insurance options and how to navigate the system, and then work with partners around the community, be they in-person assisters, health centers, county departments, or anyone else who has a vested interest in the community, get them up to speed, understanding the law and understanding how they can help their clients ultimately navigate what can be sometimes complicated enrollment process.
So the basic thing is making it a lot easier now.
Most definitely. My job is to just make sure everybody is as clearly understanding the process as possible and make it as easy for folks to engage and ultimately enroll.
Well, I'm going to take a little bit of that, the answer, and just ask you, tell me a little bit about how experience to make it a lot smoother.
So obviously, health insurance can be complicated for folks, and we know that a lot of individuals in Arizona are getting insurance for the first time. Mm-hmm. So we are making sure that folks have the ability to get in contact with in-person assisters. They're trained professionals who offer free services to get through the process, answer any questions that a consumer might have about their health insurance and what's available to them. It'll help the consumer tap into their financial assistance to help pay for health insurance, and then make sure that they leave that appointment completely enrolled, completely happy with the option that they selected, and ultimately able to utilize the health insurance that they are indeed obtaining.
You call them assister.
Indeed, in-person assisters.
What's it called?
In-person assisters.
In-person assisters. And they basically are there to assist.
Exactly. So anything from what do these terms mean, what is the deductible, what is a copay, all the way through, does this health insurance plan cover the doctor that I'm used to seeing, does it cover my medications, anything in that bandwidth they will be able to help a consumer with, so that they are making the comfortable and confident decision when they choose their health insurance plan.
Scott, I know that there is financial assistance available for those who qualify. Tell me a little bit about it.
The financial assistance was one of the big movers of the Affordable Care Act, or Obamacare, and frankly 90% of Arizonans qualify for either free health insurance through Medicaid, the Access program, or through the federal marketplace. And so folks who make above a certain income threshold but below 400% of the federal poverty level have some sort of tax credit coming their way. They can take it each month and reduce their premium amounts, but they're also going to be able to take it when they file their taxes next year as a part of their refund. So there's a lot of options in play. Even last year I was working with a woman who was 62 years old, not quite to Medicare yet, but wanted to explore her options. A health plan that would have cost her $363 with the financial assistance came down to $3.60 a month. So the financial assistance is very crucial for folks, and we know that most individuals who are currently uninsured think that health insurance isn't affordable for them, but at the end of the day, 66% of Arizonans qualify for a plan that's less than $50 a month.
I know that they say websites are so easy, we can navigate them about. I like to talk to people.
For sure.
Okay, so is there other ways to reach you via telephone or anything like that, opposed to just the website?
Yes, so we know, and that's one of the main reasons a lot of people like to sit down with the sisters, is technology is crazy sometimes. And so and so we do have the toll-free number that folks can call. It's 1-844-790-4946. And so you'll call, there'll be an assister on the other end who can walk you through a couple of the basic questions, and then if you want to sit down for that one-on-one appointment with a in-person assister nearest you, they can schedule that up. You go in there, have that trusted relationship, share what you're looking for, and ultimately they'll take care of you and get you through the process.
You kind of stumbled just a tad bit on that phone number, so I'm going to ask you to give it. To us again.
For sure. The toll-free phone number is 1-844-790-4946.
Okay. Now, as we said, open enrollment started November 1st. It ends January 31st. If someone, for whatever the reason may be, out of the country, wherever they're at, and do not apply by January 31st, I don't want to open up a Pandora's box, but is there any hope for them to be able to still get on the system? So
the honest truth is that it's a very small number of folks who are going to be able to go through the marketplace and find insurance after January 31st. Yeah. You have to qualify for what we call a special enrollment period, or a SEP, and those are for significant life events. So if you were out of the country and moved back, if you have a change in family size, maybe you got married or divorced or had a child, if you were released from prison, any of those types of elements can qualify for someone to enroll after January 31st, but they only have 60 days from that particular incident. So So if they had a child, they have 60 days from the birth of that child to go into the marketplace, report the change, and find an insurance plan that works best for them. But anybody who's on access or access eligible, and we can do that screening for them, there's no deadline for that. But again, the sooner you get covered, the sooner you're going to be saving time, energy, and headaches, and ultimately money in terms of health insurance.
Okay, you say if your access covered, there is no time limit. So what you're saying to me is after January 31st, if I'm on access, I can still apply for Obamacare.
So you can, yeah, you'll still be able to apply for access after January 31st, but we know that oftentimes folks don't know which universe they qualify for. And so it's important for the audience to know that they should do their due diligence now, preferably before December 15th, so that their coverage can start on the 1st of the year, and they'll be taken care of throughout all of 2016.
I tell you what, the website, which we will be putting up there, is very important for us to continue to let people know about. And also, if you could just tell us a little bit, that telephone number once again. Those are two very important things, and the enrollment period.
Indeed. So open enrollment is November 1st to January 31st. Obviously, the sooner is better. So in addition to coveraz.org, which has a host of resources, and the Get Covered connector to find an in-person assister closest to you, you can also call the toll-free line at 1-844-790-4946.
Scott Hall, you've been great.
Much appreciated.
Thank you very much. We appreciate you coming. Good luck on your open enrollment, and I will talk to you again soon.
Most definitely. We appreciate it.
We want to thank you for joining us today. I hope you learned something today. I certainly did, and we had some good guests on about the open enrollment for the Obamacare program, health program. It's a very important program. So we want to thank you for joining us. I want to thank you for looking at us over the years that we've been here in the Valley. So have a good week. You can join us next week, same place, same time, when Focus continues.